Hello, I am Dr. Girish Nelivigi, Urologist and Andrologist from Nelivigi Multispeciality and Urology Hospital in Bellandur, Bangalore. As part of our video series, today I am going to speak on another facet of prostate cancer, which is the diagnosis of prostate cancer. Last time I had spoken on the overview of prostate cancer, and this time we will be speaking on how we diagnose prostate cancer. Now, before a doctor diagnoses prostate cancer, how can the patient himself diagnose prostate cancer? Or in other words, are there any warning signals of prostate cancer, or are there any specific warning symptoms of prostate cancer? Well, the answer sadly is no. There are no specific warning signals of prostate cancer. Any elderly male is prone to get prostate cancer. So a person in his late 50s, 60s or 70s who is prone to prostate cancer will have symptoms related to benign prostatic enlargement or just prostatic enlargement. And what are these symptoms? He may have difficulty in passing urine. He will have to use pressure to pass urine. Sometimes he will have to get up in the night 2 times, 3 times or even 4 times to pass urine. Even after he passes urine, he feels some amount of urine is left in the urinary bladder and he wants to go to the toilet again. And there is also the symptom of urgency of urination, which means the person wants to rush to the toilet to pass urine, otherwise he may leak urine in the clothes. Now, none of these symptoms are attributed to cancer prostate. All these symptoms are because of enlargement of the prostate. So, as I told you earlier, there are no specific symptoms of prostate cancer. Even when someone gets blood in the urine, even that is not specific for prostate cancer. So, how do you diagnose prostate cancer? The only way to diagnose prostate cancer is to do a blood test once every year and see if the results are normal or abnormal. Now, what is the name of this blood test? It is called serum PSA or serum prostate specific antigen. This is a blood test which is carried out in the laboratory. You get the report on the same day, and if it is abnormal, you have to show it to a urologist who will decide what to do next. Now, what happens when you go to the urologist? A urologist will take a history and will do a physical examination. Physical examination is very important because when a urologist examines the prostate, he can to an extent make out whether it is cancerous or non-cancerous. Along with the physical examination and the serum PSA report, the urologist will recommend a biopsy of the prostate if needed. What is biopsy of the prostate? It is putting a needle in the prostate through the rectum, because prostate is accessed through the rectum. A needle is put in the prostate and multiple cores of prostate or pieces of prostate are taken. Each piece measures a few millimeters in size, and these small pieces, numbering about 6 to 12 or 18 depending on what the urologist feels, are then sent for testing under microscope or histopathology. This report will take about 3 to 4 days to come, and the prostate cancer is diagnosed based on the microscopy results. So this is how a prostate cancer is diagnosed. An ultrasound, a CT scan, MRI are also carried out, but they are not very specific. Sometimes an MRI can detect a prostate cancer, but it has to be confirmed by doing a prostate biopsy. So this is about the diagnosis of prostate cancer, and I will be talking to you again on the other facets of prostate cancer in my next video. Thank you very much.